Hi, this is Dr. Gans again, and this is the final video in our 6-part series on dental emergencies. In this video, we're going to discuss just some general dental problems that arise and some of the solutions that may help you if you are unable to get to your dentist immediately. There are 5 questions that we're going to talk about. I've been told I have a cavity. Is that the same thing as a filling? And what is a cavity anyway? My tooth is throbbing and it's kept me up all night. Is there anything I can do to help control the discomfort? My tooth broke and there's a sharp edge. My tooth or my child's tooth fell out or was knocked out. And finally, I have a toothache. Is there anything specific I can do before I come to the office? Now, once again, before we provide this advice, it's important for you to review the disclaimer on video 1. First question, I've been told I have a cavity. Is that the same thing as a filling? Well, a cavity is basically a hole in a tooth caused by decay. A filling is the substance you place within the cavity after it has been cleaned in order to replace the lost tooth structure. It's important that small cavities are taken care of before they become big cavities. Big cavities can lead to root canal, infection, and possibly even tooth loss. Taking care of small cavities now can save you a great deal of time and money in the future. Now, one of the problems that occurs is that people will get a toothache. They'll look and see a small little hole and be told they have a small cavity, and therefore let it go for a period of time. Remember, decay does not go away by itself. The sooner you take care of the problem, the better off you're going to be. Next is my tooth is throbbing and it's kept me up all night. Is there anything I can take to help control the discomfort? Now, if you let that small cavity go and it's gotten larger, a throbbing type of pain is usually indicative of a nerve problem, meaning that decay has gotten pretty close to the tooth nerve. The best medication to take for this discomfort, as long as there are no medical contraindications for its use in your case. Now, you may need to consult your physician to check to see if there's any reason not to use this medication, but the medication of choice is ibuprofen, that's Motrin or Advil. Now, these medications are anti-inflammatory in nature and can be helpful to decrease the inflammation within the nerve. If that doesn't work, you can also try some of the over-the-counter analgesics. Most often, a prescription for an antibiotic is indicated, but this will require a call to your dentist's office. Now, there's also a possibility that the nerve in this tooth has died. Now, if that is true, it will be necessary to have root canal therapy, otherwise known as endodontics, done in order to avoid potential infection and even more increased discomfort. We suggest you give your dentist a call right away if you have any kind of throbbing dental pain, especially if it's keeping you up at night. Now, if you have a broken tooth and a sharp edge that's cutting your tongue, what can you do? Well, the best thing to do for a sharp or chipped edge of a tooth is to find a candle, heat the wax up, and mold a little piece and put it over the spot. Place the wax on the broken tooth to protect your tongue and cheek. And then call your dentist before that sharp edge irritates or cuts your tooth, your tongue or cheek even more. Now, if you or your child loses a tooth or it's knocked out by accident, it's important to retrieve the tooth. Now, follow the instructions carefully. Hold the tooth by the crown. That's the part of the tooth that you typically see in the mouth. And rinse off the tooth root if it's dirty. Now, don't scrub it or remove any of the attached tissue fragments. Just gently clean it. If possible, put the tooth right back in the socket. Now, if that's impossible, then put the tooth in a container with milk. Or if no milk is available, use water. And then get to the dentist as soon as possible. Reimplantation sometimes is effective, but it's necessary to follow the above rules in order for it to have any chance at all. This applies to adult teeth as well as children's teeth, although success in children is far greater than with adults. Now, I have a toothache. Is there anything specific I can do before I come to your office? Well, a toothache can be caused by so many things: decays, fracture, infection, etc. The type of pain and its duration can be helpful to your dentist in order to prescribe the proper treatment over the phone. Once again, a throbbing type pain may be indicative of a nerve problem. The best medication, as we have mentioned before, is something called ibuprofen, which is Motrin or Advil. These types of medications are anti-inflammatory and will help reduce the inflammation. You also may need to have root canal therapy done, so it's important to go ahead and give your dentist a call right away. That completes the 6-part series on dental emergencies. You can find more information, some post-operative instructions, and some more notes on dental emergencies at 911dentalonline.com, your online resource for dental emergencies.